Welcome to the Holistic Psychiatry Podcast. I'm Courtney Snyder, a physician and holistic adult and child psychiatrist. In this episode, I'll be talking about Candida, specifically barriers or obstacles that get in the way of healing. So Candida overgrowth in the gastrointestinal tract is a common cause of brain symptoms. Because I've discussed Candida in a previous podcast, which I'll link to, in this one, I wanted to discuss factors that make it difficult to move past Candida. Before I do, I'll briefly summarize. So Candida is the most common fungi in the microbiome. So it's supposed to be there. However, if it overgrows or colonizes our gastrointestinal tract, we can develop several symptoms and conditions, including those that are brain-related. So hallmark symptoms include constipation and significant carbohydrate craving. There can also be skin issues, weight gain, and a number of other physical issues. However, it is also a common cause of brain fog, fatigue, anxiety, depression, mood swings, and insomnia. Children with Candida are often diagnosed with ADHD or ADD. A number of factors can lead to yeast overgrowth and play a role in its persistence, which I'll address again in this newsletter. Assessment can be done through blood, urine, or stool testing. My preference is to use an organic acids test, which is a urine test that measures metabolites of yeast. The main aspects of treatment include killing the yeast with antifungals, while also not feeding those microbes. This means being on a low carbohydrate diet. For some, this is sufficient. However, for many, Candida can be a chronic challenge to have to deal with. This episode goes out to those who have Candida and feel they just can't move past it. If that's you, I hope something here helps you do just that. Okay, so this time I was not trying to come up with a list of 10, but somehow this list just became a list of 10 without me intending. So here we go. 10 factors to consider when having difficulty moving past Candida overgrowth. Number 1, low zinc. Aside from being one of the superstar nutrients when it comes to brain health, zinc is a superstar for the immune and gastrointestinal symptom. If we are relatively low in zinc, we can be more prone to infection and overgrowth, including Candida overgrowth. Instead of typical lab ranges, I aim for the Walsh-Pfeiffer optimal ranges when discussing zinc. This is something I've talked about in other podcasts. Interestingly, zinc is one of the nutrients that Candida uses, which can contribute to the depletion of zinc when someone has overgrowth. Despite that, I would still want to support the immune system by optimizing the zinc so the immune system can fight Candida. Malnutrition and decreased absorption of zinc due to alcohol and certain medications can cause low zinc. In my work, pyrols, high oxidative stress from illness, inflammation, infection, toxicity, as well as aging are other reasons for depletion of zinc, and I would say more common. Most people with brain conditions and most people who are over the age of 65 will have relatively low zinc levels. To optimize zinc, we're normally checking zinc levels along with copper, and the reason for that is because zinc supplementation has the potential to bring copper down. So it's important to know where both of those are prior to starting any supplementation, and to know if someone may need copper supplementation, which I would say is usually not the case. Number 2, mold toxicity. Mold weakens the immune system. It is very common for those with mold toxicity and colonization to have Candida. Separately, if someone with Candida can't tolerate an antifungal medication or supplement, I suspect they have mold toxicity. If they are already toxic and more toxins are released when Candida is killed with antifungals, there can be more toxins than they can tolerate. Identifying and addressing mold can be necessary for someone to move beyond Candida. And in fact, when we're treating someone for mold, one of the first steps is to put them on binders to bind up those toxins. And so that then when we go to treating them for Candida, they're usually able to tolerate that much better. Number 3, high blood sugar. Sugar, from refined sugar, refined carbohydrates, and a high carbohydrate diet, will feed Candida. This is particularly frustrating as Candida often drives persistent and intense cravings for sugar and carbohydrates. Eliminating sugar is necessary for most who want to move past Candida. Carbs are ideally less than 60 grams, though most people may need to go as low as 40 grams while being on antifungals to be able to move past this. And there's a great deal of variability in terms of how much someone may need to do. Number 4, lack of movement and exercise. What we put into our bodies isn't the only thing that impacts our blood sugar. Exercise has a big impact on blood sugar regulation, which is why it's such an important part of diabetes treatment. You won't necessarily hear about it as a treatment for Candida, but really it should be. Exercise will also help promote detoxification, lower stress, which I'll be talking about, and increase the movement of the bowels, all of which are important in healing from Candida. Number 5, stress. When we are under acute or chronic stress, we usually have high levels of cortisol, and we have high levels of catecholamines, so dopamine, norepinephrine, and epinephrine, or what is epinephrine is referred to as adrenaline. Together, these will cause our blood sugar to increase, all in an attempt to prepare our body for fighting or fleeing. There are endless ways we can live in stress, many we don't even think about. There is the stress of modern life, our unique daily stress, stress from trauma and early attachment experiences, relationship stress, especially if we haven't learned how to set healthy boundaries, and the stress of needing certainty, the fear of the unknown. There's even the stress of futility if we don't feel purposeful in our lives. We can also have internal stressors such as chronic toxicity and inflammation. EMF, or electromagnetic fields, can keep our body in a state of chronic stress. Some of us will be genetically vulnerable to have a more exaggerated stress response. Examples could be having a slow COMT or MAOA, and these are genetic variants which make enzymes that help with the clearing of the stress neurotransmitters that I mentioned. High copper, which can result in high adrenaline states, or high pyrroles, which can impact the calming neurotransmitter GABA, all can contribute to having an exaggerated stress response. The CAPS personality profile, as described in RCCX theory, which is not unlike the highly sensitive person description, if you've heard of that, also would contribute to an exaggerated stress response. And just as there are endless ways to have chronic stress, there are endless ways to lower our stress response, many of which I've talked about in these podcasts. Number 6, high estrogen. High cortisol isn't the only hormone that can contribute to persistent Candida. High estrogen states can as well. It has been shown that estradiol impacts the expression of several genes that help regulate Candida. Estrogen can be high for several reasons, including oral contraceptives or birth control, hormone replacement, and high exposure through synthetic xenoestrogens. So these are chemicals that can be found in household products, certain plastics, and on insecticides that may be on our food. Estrogen can also be high due to alcohol use, impaired liver function, and higher body fat. So our fat tissue can make estrogen. If someone has a slow COMT variant, they may have more difficulty metabolizing estrogen along with those catecholamines. Aside from lowering xenoestrogens, we can support estrogen metabolism and avoid adding more estrogen. Number 7, lack of gut motility. If our food isn't moving through our digestive tract, Candida can have more opportunity to overgrow. Slow gastrointestinal motility can be caused by toxins and can be caused by connective tissue conditions such as Ehlers-Danlos syndrome, diabetes, and hyperthyroidism. When we are sedentary, there is less blood flow to the digestive tract. This also impacts motility. Candida itself can contribute to decreased gut motility, resulting in toxins in the GI tract getting reabsorbed into our bloodstream. Addressing constipation is an important starting place when treating Candida, but many tools can help stimulate gut motility. Just one example is accessing the vagus nerve. Number 8, insufficient digestive enzymes, stomach acid, and/or bile acids. Poorly digested food can become a source of fermentation for Candida in the small intestine and contribute to overgrowth. Poorly digested food is another cause of constipation and again needs to be addressed early in Candida treatment. When Candida starts to die off from antifungals and dietary changes, toxins are released. If those toxins aren't eliminated with the stool, they are reabsorbed and add to further toxicity, which can make someone feel pretty bad, and we call this die-off. So it's particularly important to be able to move those toxins out. Examples of digestive supports include digestive enzymes, betaine, HCl, and bile salts, and so those may be needed in varying combinations. And again, we're talking about persistent Candida, which isn't necessarily the case for everyone. There are also natural sources, certain foods that can stimulate the release, for example, of bile salts from the gallbladder. And a nice resource on this is Dr. Jill Krista's book, Breaking the Mold. Number 9, unaddressed biofilms. So biofilms are protective coverings made by Candida and other microbes that protect them and can prevent antifungals, so the medications or herbal treatments used to kill yeast. It can keep those from being able to do their job. There are particular supplements that can help break down biofilms. One example that I use in my practice is Interface Plus, which is a blend of EDTA and particular enzymes. Number 10, inadequate beneficial bacteria. So this one won't necessarily come as a surprise, but Candida overgrowth typically starts when antibiotics have knocked out enough beneficial bacteria, allowing the Candida to overgrow. Probiotics can help crowd the Candida out. So as you can see, there are many opportunities here beyond simply taking antifungals and lowering carbohydrates. So that rounds it out, and I hope this information has been useful to you. If you're someone who has dealt with this, or if you're a clinician and want to add to my thoughts, please consider commenting. If you are interested in receiving this newsletter or podcast episode into your mailbox each week, please consider subscribing at CourtneySnyderMD.com or on Substack. Until next time, take care.